Good morning, everyone. I'm Maria Hazel Incinares, a registered nurse. I hope everyone's fine because today I will be discussing about mental health and psychosocial counseling. So, when you hear mental health, what comes in your mind? Most of us would think baliw, krung-krung, siraulo. These are the negative connotations about mental health because mental health is something positive. Mental health, according to WHO or the World Health Organization, it is the state of well-being. When we say state of well-being, an individual realizes his or her own abilities. He or she can cope with the normal stresses of life. He or she can work productively and fruitfully. When you say productively, it is not just accomplishing something, but being productive. He or she can contribute to his or her community. So it doesn't stop from yourself, but you have to contribute to your community. So, according to World Health Organization or the WHO, Philippines had one of the highest cases of depression in Southeast Asia, affecting more than 3 million Filipinos. 88 cases of mental health problems were reported for every 100,000 Filipinos. So, it is very important to raise awareness on mental health and mental disorders. So, what are the common types of mental disorder? So, before we start with the common types of mental disorder is a condition that has negative effects on the way the individual thinks, feels, and behaves. So, the first common type of mental disorder is depression. Depression is a serious medical illness that negatively affects how you feel, the way you think, and how you act. So, what are the signs and symptoms of depression? We have persistent sadness or empty mood, feelings of hopelessness or pessimism, feelings of guilt, worthlessness, uh, fixating on past failures or self blame. We have loss of interest or pleasure in activities and hobbies. So when those activities that you previously enjoyed can no longer hold the same joy. So next is decreased energy or fatigue, moving or talking more slowly. Even on small tasks, it takes extra effort. Next one is difficulty concentrating, remembering, or making decisions. What else? We have difficulty sleeping or insomnia and oversleeping. We have appetite or weight changes. It is either you eat a lot or you eat a little. Next is irritability. You easily get irritated over small matter. Next is thoughts of death or suicide attempts. Women are most likely to try to kill themselves, but men are most likely to die from it. Why? Because men uses lethal means to commit suicide like firearms, while women uses pills. Some people with depression are just quiet and you can see them smiling. According to the study, it takes 10 years for a person with depression to seek help. So what can you do to prevent or to reduce depression? You have to, first is you have to reach out for your loved ones and your friends. Next is talk to your spiritual leader. And the third one is to get treatment when at the earliest sign of problem to prevent depression from worsening. The next common type of mental disorder is anxiety disorder. Anxiety disorder involves more than temporary worry or fear. Person with an anxiety disorder, the anxiety does not go away and can get worse over time. Symptoms can interfere with daily activities such as job performance, schoolwork, and relationship. The difference between anxiety disorder to other fear or phobia. Under anxiety disorder, you cannot pinpoint the cause of fear or worry. So what are the signs and symptoms of anxiety disorder? We have feeling nervous, restless or tense, having a sense of impending danger, panic or doom, having an increased heart rate, because when a person experience emotional stress, our body releases stress hormones called cortisol that regulates the cardiovascular functions like heart rate and blood pressure. Breathing, next one is breathing rapidly or hyperventilation. Next is sweating, trembling, feeling weak or tired, trouble concentrating or thinking about anything other than the present worry, having trouble sleeping, experiencing gastrointestinal problems like indigestion, constipation, diarrhea, and heartburn. Next is having difficulty controlling worry, having the urge to avoid things. High levels of anxiety can prevent you from doing activities. Next is we have the next common type of mental disorder is bipolar disorder from bipolarity. It has two spectrums called mania and depression. It is also formerly called manic depressive illness or manic depression. It is a mental disorder that causes unusual shifts in mood, energy, activity levels, concentration, and the ability to carry out day-to-day tasks. So what are the signs and symptoms of bipolar disorder? Under mania, we have extremely high energy. So they are overly happy with raising thoughts. Next is grandiose levels of self-esteem. They have a feeling of superiority and also overconfidence in their abilities. Next is loud, rapid speech. It is a result of rapid thoughts. Next is very little need for sleep. Some people do not sleep for 2 days. Next is engaging risky behavior such as drug and alcohol abuse, and also getting into trouble with the law. Under spectrum depression, feelings of lethargy, both physically and mentally. High levels of energy during mania can cause difficulty sleeping, and also on the other run, it can cause uh, tiredness during the day. Next is a sense of personal worthlessness, eating too much or too little, overwhelming sadness, and thoughts of suicide. So, what are the things that you can do to manage bipolar disorder? The first one is to keep regular schedule or stick with the routine to control your mood swings. Next is to practice healthy sleep habits and also to avoid alcohol, caffeine, and drugs. So the next common mental disorder is the schizophrenia. Schizophrenia is a serious mental illness that affects how a person thinks, feels, and behaves. People with schizophrenia may seem like they have lost touch with the reality, which causes significant distress for the individual, their family members, and friends. So, what are the signs and symptoms of schizophrenia? We have psychotic symptoms like altered perceptions like vision, hearing, smell, touch, and taste. So they are experiencing hallucinations and delusions. Uh, they feel that they are in danger, even though there's no proof that it is true. Having abnormal thinking and odd behaviors like irrational uh, angry, and what else? Laughing without any reason. So, what are the signs, physical signs, and symptoms of mental disorder? We have fatigue, back pain, chest pain, digestive problems like constipation, diarrhea, indigestion. We have dry mouth, headache, sweating, weight gain or weight loss, rapid heart rate, and dizziness. So, mental health conditions can also begin to develop in young children because they're still learning how to identify about their thoughts and emotions. Their most obvious symptoms are behavioral. So, what are the signs and symptoms of mental problems in children? Okay, before that, according to WHO, about 10 to 20% of children and adolescents experience mental health problems. Half of all mental disorders begin at the age of 14. So, what are the symptoms in children? We have changes in school performance, excessive worry or anxiety, for instance, fighting to avoid school, hyperactive behavior, frequent nightmares, frequent disobedience or aggression, and the last one is frequent temper tantrums. So what are the causes of mental disorder? We have the first one, hereditary. If both parents are schizophrenic, there is a high chance that you can acquire mental disorder. Next one is the psychosocial. When a person that worries with broken homes, poverty, stress, changing family structure, rejection, economic insecurity, and under environmental, we have toxic substances like drug and alcohol abuse. Next is mineral deficiency like iodine. Our thyroid gland takes iodine from the food we eat and convert it into thyroid hormone. Next is traumatic factors such as physical and sexual abuse. So other contributing features, social and environmental causes, this might be the things such as where we live, the physical environment where we live in, our place of work if we are under too much pressure. Next is whether we have close family and friends. It is very important that we have our support system during our difficult times. Next one is what are the treatment aspect of mental illness or mental disorder? We have the first one is the initial assessment. The role of psychiatrists and general practitioners. Help is available through both public and private healthcare, such as Help Hotline. Next is psychological treatment or psychotherapy. Psychotherapy is also known as talk therapy. The most common type of psychotherapy is the CBT or the cognitive behavior therapy. So what is cognitive behavior therapy? It is where you can assess, you will be aware of the negative thinking or the negative emotions that you have and changes it to positive thinking. So there are ways to manage these emotions. So next is treatment with medication such as antidepressant drugs and anxiolytics or anti-anxiety drugs. And sometimes it is done with the combination of psychotherapy and medication. Next is when you have mental illness, people tends to have stigma with those people with mental illness. So what is stigma? Stigma is discredit or disgrace a person from the society. So what are the experiences of stigma? We have social exclusion, shame, secrecy, blame, discrimination, and isolation. Next is what educators can do in classrooms, school, and home. First one is you have to educate staff, teachers, and parents on symptoms of first aid and first aid for mental disorders. Later on, we will discuss about psychological first aid for mental disorders. So, we have to promote social and emotional competency and build resilience to students and children. So, how can we promote social and emotional competency to students and children? You have to teach them to work in group for them to develop their leadership skills and uh, to uh, to discover their own strength and also to make the students cooperate and negotiate with others. Next is to teach and reinforce positive behaviors and proper decision making. How can you teach and reinforce positive behaviors? We have to give rewards to good behaviors and or praise good behaviors and also to give problem solving, teach them problem solving skills like do it yourself projects. Next is encourage good physical health. So what is the psychological first aid? Psychological first aid is a humane, supportive response to fellow human being who is suffering and may need and who may need support. It is an emotional and practical support to reduce distress and foster the ability to cope, adapt, and recover. You will enable to help or support other people and also yourself under psychological first aid. So what are the action principles of psychological first aid? We have look, listen, and link. Under look, we assess for safety, find those with priority needs or serious distress, who seek supports, the needs of the affected, expected emotional reactions. Underlink, okay, we have to begin the conversation. Introduce the helper. Of course, you have to introduce yourself. Pay attention and listen attentively. Accept feelings. Calming someone in distress. Ask about needs and concerns. And lastly, help find solutions to needs and problems. Under link, we have to assist people to basic needs and services to informations, connecting with loved ones and social support, accessing services and other help such as help hotline. Next is what psychological first aid is not. It is not something that only professionals can do because anyone like government officials, community health workers, and yourself can provide psychological first aid. It is not professional counseling, and also it is not asking someone to analyze what happened to or put time and events in order because it is done by healthcare professionals such as psychologists and psychiatrists. Next is what are the things to say and do when you give psychological first aid. We have give information in a way that the person can understand. So don't give false promises or false information. Next is acknowledge how they are feeling and any losses or important events they share with you, such as home or death of a loved one. Next is respect privacy. You have to keep the person's story confidential. Next is acknowledge the person's strength. Okay, next we have to try to find a quiet place to talk to avoid distraction. Next is let them know you hear them, like nodding or saying so that in that way you can tell them that you are listening with their story. Next is be patient and calm. Okay, what are the things not to say and do when providing psychological first aid? We have the first one, don't pressure someone to tell their story. Don't be too intrusive or pushy. Don't interrupt. Next one is don't interrupt or rush someone's story. Next is don't touch the person if you're not sure if it is appropriate to do so, especially to females. Next is don't judge what you have or haven't done or how they are feeling. Don't say you shouldn't feel that way. You should be lucky you survived. First, because sometimes even if you have the same situation, you don't have the same experience. So never say you shouldn't feel that way. So next one, what are the pillars of self-care? The first one is knowledge and health literacy. The desire for learning about health and wellness. The next one is physical activity. Under physical activity, you can do meditation or exercise. Exercise reduces anxiety, depression, and also it improves your self-esteem. The next one is healthy eating. What you put in your body has powerful influence to your well-being. So next one is risk avoidance. Avoiding drug and alcohol abuse and also the use of tobacco. Next is good hygiene, getting enough sleep. Next is, what are the ways to manage your stress? We have the first one, think about what has helped you cope in the past and what you can do to stay strong. Try to take time to eat, rest, and relax for short periods. Next is to talk with your friends, loved ones, or other people you trust for support. Next is try to keep reasonable working hours so you do not become too exhausted. So we'll talk about resilience. So what is resilience? Resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress. Can resilience be developed? Yes, we can develop resilience in several ways, like doing exercise, get enough sleep, for you to control your stress easily. The stronger you feel physically and emotionally, the easier for you to overcome challenges. Okay, next. What are the ways to increase positive emotions? We have the first one, more gratitude, less attitude. You have to be grateful with what you have. Don't focus or stress yourself on the things that you cannot control. And also, grateful people are the happiest people. The next one is learning optimism. Teachers, this is very important that you watch out your words because children, it might be the reality of your children or the students. For example, when you say a certain student is bobo, it will become his or her reality. So you have to take care of the words you tell towards your students or your children. And what else? You have to think about your mantra. You have to say you are beautiful. In that way, you can develop positive thinking, wherein positive thinking triggers positive emotions. Next is humor and laughter. Laughter decreases levels of stress hormones called cortisol and also boost your mood. It changes your mood into a positive. So next one. So before we end our discussion, uh, I want to share with you the words from Lao Tzu. If you correct your mind, the rest of your life will fall into place. So that's the end of our discussion. I hope you learned today. God bless everyone. Thank you for listening.